Thanks for joining us in ALTY's Bone Healthcare series with me, Sarimah Ibrahim, and I'm here with two wonderful guests. We're continuing our conversation with Dr. William Maloney and Dr. Mark Chong from ALTY. We're discussing the advances in orthopedics. Now, you're probably wondering, what are you talking about? You know, our knee replacement, hip replacement, scans for the body. What else is there? Well, Dr. Mark Chong's going to talk a little bit about robotics in orthopedics. And what I'd like to know from Professor Maloney is, I mean, obviously robotics in the US and the rest of the world, it's been used for more than 2 decades. I mean, gene therapy, tissue replacement, this is something that's like started already. Can you talk a little bit about the comparison between the US in terms of advancement and a country like Malaysia?
So, you know, we're sort of privileged in the U.S. to get technology early on, and so it's our job to make sure that, in fact, adds value.
Right.
Robotics, as you say, have been around for a long time, but the current form of robotics is really fundamentally different than what we've had in the past. And I think this generation of robotics probably is here to stay because it allows us to do the surgery more accurately.
Right, and faster. No.
Not necessarily faster. There's a little bit of a fiddle factor. It gets maybe probably beyond this discussion, but the goal is to do the surgery as accurately as possible, and robotics allow us to do that.
And robotics, Dr. Mark Chong, something that you've been doing. So would you like to elaborate a little bit?
Yeah, so robotics in, at least in the Southeast Asian region, I would say technology has been introduced about 5 to 6 years ago, and I remember being the first user of the Mako hips in Singapore when I used to practice.
And what is that? Can you explain that?
So basically, it's a robotic system that allows you to place the orthopedic implant to the exact position that you want to do for that ideal situation for that particular patient.
So I'm just looking at the hip here and the knee here.
Yes, that's right. So you can see from that model over there where the hip is positioned.
Yes.
It looks pretty flush. The cup looks very nicely fit.
It looks flush. I only know flush when my blusher's been applied.
So it's an orthopedic term, I realize.
A flush hip.
Yes, so it looks pretty accurate. That's where it should be.
Okay, this obviously it should be. I mean, it's not going to be up here.
So in conventional surgery, without the robotic, the surgeons are trained to do, to put it in the right place.
To do the flush.
Yes.
Yeah.
However, with the robotic technology, it allows you to quantify them in values. It gives you a certain degree where you want to put it.
Okay.
And 9 times out of 10, you get it right.
You get it right.
Yes.
You think about bone carpentry. We're carpenters. We just operate on bones instead of wood.
That's true.
Middle-class carpenters.
Non-union. I don't know.
Right.
Okay.
So when we historically did hip and knee replacement, we did it with cutting jigs and saws.
Wow.
And power saws.
When you think about that.
Yeah. And so what the robot is a more refined saw, more refined cutting tools.
Yeah.
It's accurate to the 1 millimeter or 1 degree, probably more accurate than we can be with old-fashioned cutting blocks and our eyes. Yeah.
Okay, so and that is here at ALTY. So we want to talk a little bit more about single specialty and that kind of treatment, that kind of service with somebody like yourself, Dr. Mark Chong, using the robotics. I mean, obviously that is an added advantage and something that you can provide for patients at ALTY itself. Could you tell us a little bit about some of the more interesting or difficult surgeries that you've had to do or you've seen at ALTY?
Yeah, so I mean, ALTY being single specialty hospital, we get referrals from other referring surgeons around the region, especially with the more complex cases that can't be dealt with in the other multi.
Because they're just not as amazing.
I wouldn't say that necessarily.
I wouldn't say that.
Well, I said it, and that's okay.
So we do, like what Dr. Maloney was saying, we have the right hardware, as well as the software to go with it.
And the surgeon.
Right, so the hardware is being the technology that we have, the scanning system, the robotic system, but we also do have the software to go with it. The people, the skills, and the team.
Yes.
That does the same thing consistently and we do that repeatedly.
Yes.
So the skill sets is obviously more focused, and hence we're getting all these referred cases to us, and it's, some of them are really complex that you wouldn't be able to do it in
I
think you'd be struggle to do it in the
conventional multidisciplinary hospital.
Correct.
Okay, so let's talk a little bit about patients' beneficial treatments that they can have at ALTY. I mean, obviously you talked about costs. Professor Maloney, you talked about the focus being there. What else is the benefit for a patient that say has needs to do a hip replacement? I mean, why would they choose ALTY over any other hospital that's out there that they're more familiar with, that they've culturally or traditionally or in their family they've been seeing that doctor? Why would they transfer to ALTY?
Yeah, I think the two most important things in outcome are the surgeons and the facility you're at. And so patients ask me, well, should I come to you or should I go to my local doctor? I said, first and foremost, pick your surgeon, pick someone that you respect, you think is going to take good care of you.
Right.
But the facility also matters, right? So the ability to do things efficiently, to have the OR technicians who understand your protocols, you're not getting a different nurse all the time. A 2-hour operation can be 1 hour if you have the right OR team. Fast operations matter. So the whole team approach where everybody's on the same page, is focused on your specialty problem, whether it's hip replacement or your heart or cancer, has a distinct advantage.
So talking about the pandemic, let's talk a little bit about how we've just come out of the pandemic. I mean, we're not fully out of it, but I know that it did give a hit to the orthopedics in the sense that, shut down, not seen as essential. What is a hip replacement, if compared to a life-saving, surgery, etc. So how did that affect you in the US, Professor? I know that Stanford had to shut down and focus on the essentials, and how is it now coming out of it?
Yeah, so March 13, 2020, we completely shut down. No elective hip or knee replacement, no elective spine surgery. So my surgeons had a lot of time off.
Okay.
And then eventually I had to get them back to work, which was a challenge.
They all come in with problems then, because they've been sitting down too long doing it online.
Yeah, they got used to the time off, which is not a good thing. Two things came out, the silver lining.
Okay.
Number one is it forced us to start to have virtual visits, so patients could visit with us in the office at home.
Okay.
And technology obviously was the driving force behind that.
Yeah.
And it also accelerated the short stay or outpatient hip and knee replacement because we didn't have hospital beds.
Yeah.
So if you needed to have your hip replaced, I had to do it in the outpatient setting.
So you just meet me that day and it'd be like, hello, Professor Maloney, now do my knee or hip.
We might have met on the little screen or the big screen. And the first time I saw you face to face might have been in the pre-op area.
Whoa.
Which is a little disconcerting.
That's a bit strange, yeah.
But actually the patients accepted it and outcomes were fine.
It's better than not doing anything. And I'm sure, Dr. Mark, you mentioned ALTY also suffered a hit there.
Yes.
And what did you observe during the pandemic and now?
So very similar to Stanford, we had to cut down all the elective surgeries, which were considered non-essential. The only thing that were going on was, we do offer trauma services. Trauma still kept going. Obviously, cancer services and heart surgery. Like you said, there's always a silver lining. So we utilize the technology such as virtual consultation, and people still have that one-to-one relationship with the doctor.
So important.
I wouldn't say that's ideal, but the pandemic forces us to adapt that technology
Everybody,
quicker. So the silver lining is that we actually accelerated that part of the services, but also the important thing is the patient actually wants to stay less in hospital following the operation. So actually it's a bonus for us because our aim is to get the patient home as soon as possible after surgery, and that pandemic actually allows us to happen. Drill that thing home.
So it was a bit of a double sort of edged sword. So you had people going, well, I can now see Dr. Mark or Professor Maloney faster, and I can get in faster, but I don't get that personal sort of touch. And then, as orthopedic surgeons, you've got to look at your patients, and you've probably got to sort of analyze.
That's right. Traditional orthopedic teaching is about look, feel, and move, right?
Yes.
So you have that tactile.
You see them in the pre-operative, and they're just going, oh my God, I'm nervous.
I know it's not perfect, but the younger surgeons, I think they've been using some sort of new technologies, like putting some, range of movements indicator to measure your range of movements, give you your figures.
These are some of the advances.
So that sort of substitutes a little bit.
There's a lot of very smart young people trying to figure out how to do a virtual physical exam.
Better even.
Right? And so we lay hands on, and a lot of it's generational. The patients that are a little bit older want to see their doctor. They want to sit down and socialize a little bit. The younger patients, they can do it from their office. They say, why do I drive a half hour, pay for parking, come up to the office? The doctor's always late, right? And so
no, in Malaysia it's a bit different. The patients will come 1 hour late.
Oh, really?
That's true.
Malaysian timing
neutral,
a bit.
That's right.
Okay, so we're coming to the end of our interview today. Unfortunately, we don't have a lot of time. I know you've got to go off to your golf, and you're going to be Oh, I'm not allowed to. Oh dear. Okay, the missus wouldn't be happy with that. He's not playing golf. He's playing golf with somebody's hip bone or a kneecap. No,
it's just testing his hip.
He's just testing out new equipment. It's rehab, yeah. Okay, so Dr. Maloney, we're talking about advances in technology. Where is the future in orthopedics? And Dr. Mark Chong, is Malaysia anywhere near that? Are we catching up? Are we there already? What can we look forward to?
Yeah, go on. Yeah, so I think the single specialty hospital is certainly taking off, and definitely in Southeast Asia, ALTY being the first, and we hope that this trend will continue because I think the overall benefit of that actually is, you think about it, is to the patient. Patient likes it, and hence that's why we exist.
Yes.
I think that's the message that I think we ought to bring it out to the community.
Yes.
Yeah.
So come on over to ALTY and get checked as soon as possible. Talking a little bit about being checked, of course, we have Malaysia's only weight-bearing MRI here, where you no longer have to be claustrophobic. You just get in there. You can stand up and get checked.
Correct.
And we have the EOS imaging as well here. So I mean, we are future forward here at ALTY. So Professor Maloney, any final words or something you'd like to share with us, with the viewers, about single specialty hospitals and the future in orthopedics in terms of tissue regeneration, etc.?
Just briefly, orthopedics is a mature medical field, so advances are going to be evolutionary, not revolutionary, right? Small incremental changes. The promise of biologics, stem cells, and other tissue engineering strategies have not come to fruition yet, but it will at some point.
It will.
So, it will. So it's getting closer. Everybody thought it was a 5 to 10 year horizon.
Yeah.
It's probably a 10 to 20 year horizon. But things like gene therapy and stem cell therapy to help regenerate or augment surgery to repair tissues that are worn out in the future will be a reality at some point.
Wonderful. And are we close to that, Mark Chong, in terms of Malaysian orthopedics? Are we going to be catching up another 5 years after that, or is it going to
most definitely? I mean, most definitely. There's no difference between what's happening here and what's happening in America.
And here.
And we keep in touch very regularly. And Dr. Maloney, again, is an advisor to the hospital as well, which is great because obviously we share experiences. We have the challenges. Each countries have their own unique challenges. But ultimately, I think the trend is definitely going to stay. And
we've come out of the pandemic almost. I think that's a good thing. I mean, unfortunately, some people had to wait for treatment, but and they probably come in a little bit worse off than they were.
No question.
Yeah. Right. But we are getting back into it, and you're able to help patients and get them in and out faster. Yeah. Okay, so thank you very much to Professor Maloney. Thank you for being here today. And Dr. Mark Chong. I'll be working closely with Dr. Mark Chong here, collaborating with ALTY, finding out more, doing my surgery, getting my screenings done, and I hope that you come in and do the same. So see you again soon. Thank you very much for joining us in ALTY's Bone Healthcare series. Have a good day.